Your gums should never bleed, not even a little. If you see pink in the sink, that's your body saying, hey, I'm under attack. And trust me, you're not the only one who's thought it was normal. I used to think the same thing when I was younger, that a little bleeding just meant I brushed well. But it actually means there's inflammation, and if you ignore it, that same inflammation can start breaking down the bone that holds your teeth in place. You might be wondering why your gums bleed in the first place. It all starts with that soft, sticky film, plaque, building up around your gum line. When that happens, your body goes into defense mode. It sends blood, oxygen, and immune cells to the area to get rid of the bacteria. And that's what causes the swelling, redness, and the bleeding you see when you brush or floss. What most people don't realize is that once your gums start bleeding, you already have gum disease. The real question is, which kind? If it's gingivitis, that's the early stage. It's reversible with proper brushing, flossing, and cleanings. But if it's ignored for too long, it can turn into periodontal disease. That's when the infection starts breaking down the bone that holds your teeth in place. And once that happens, you can't reverse it. Bleeding gums are already a sign of gum disease, but it rarely stops there. Once inflammation starts, it quietly eats away at the foundation holding your teeth in place. The tricky part? It doesn't hurt in the beginning. You don't wake up one day and your teeth fall out. It's slow. Little signs start showing up, and most people brush them off. Your breath might not stay fresh for long, or food starts packing in the same spots every time you eat. You might even notice your gums pulling back or your teeth starting to look a little longer. And no, that's not just age catching up with you. What's really happening is bone loss. The support that keeps your teeth steady is breaking down, and you might start to notice new spaces between your teeth or gaps that have gotten wider over time. I've seen patients come in with a full mouth of teeth, not a single cavity, but one or two are starting to shift or feel different when they bite. They'll say, I swear I never used to have this gap. But when we take an x-ray, it's clear the problem isn't just one tooth. The bone around nearly every tooth is gone, and the only way forward is removing them all and going into dentures. That conversation never gets easy, because most of the time, they're shocked and say, but it doesn't hurt. And that's exactly the danger with gum disease. It's silent. Just like high blood pressure, it doesn't warn you with pain. By the time you feel something, the damage is already done, and fixing it takes more time, more money, and sometimes it's simply too late. The good news is gum disease can be stopped. Once you've lost bone, it's gone for good, but you can keep it from getting worse. If you have gingivitis, that's great news. It's reversible with a professional cleaning and consistent home care. But once you've lost bone, that's periodontal disease, and that needs closer follow-up. Instead of coming in every 6 months, you need to come in every 3 months. Some people can stretch it to 4 if everything looks stable, but 3 months is what actually keeps things under control. It's like diabetes. When you have a chronic condition, you don't just visit your doctor once a year and call it good. You go more often for checkups and treatment adjustments. Periodontal maintenance works the same way. It's how we stay ahead of infection and prevent more bone loss. I know some patients hesitate because insurance only covers cleanings twice a year. But let's be real. Insurance isn't designed to protect your health. It's designed to protect their profits. They don't care if you lose teeth. You do. At home, brush twice a day with a soft-bristle electric toothbrush. If you're still using a manual, it's time to upgrade. You're basically using a flip phone in a smartphone world. And floss every single day. Brushing alone only cleans about 60% of the surface of your teeth. The other 40% is where floss comes in. If you spent the afternoon gardening with your bare hands and then washed them without cleaning under your fingernails, would you really call them clean? That's exactly what happens when you skip flossing. Once tartar builds under the gums, only your hygienist can safely remove it. No rinse or gadget can reverse that. Here's what I need you to remember. Once plaque hardens under the gums, no rinse or miracle product will fix it. Please don't fall for the TikTok gum detox hacks, the miracle rinses, or those Amazon tools that promise to remove tartar. They don't work. I've seen patients try them for years, hoping to save money or avoid the dentist. By the time they finally come in, it's usually too late. The people selling those products aren't trying to help you. They're just making money. Unfortunately, the people who try them and realize they don't work rarely come back to share that part. Gum disease doesn't wait for anyone. The longer you ignore it, the more damage it causes. So if your gums are bleeding, swollen, or you've noticed new gaps between your teeth, that's your early warning sign. Don't brush it off. Schedule a cleaning, get a proper exam, and stay consistent with your visits. You can stop gum disease from progressing, but only if you act now. I'm Dr. Foxy, and I hope this helped you understand your gums a little better. If you found this helpful or informative, share it. You never know who you could help save a tooth or two. And don't forget to subscribe for more Straight Talk Dental videos that keep your smile healthy and strong.